Good afternoon and welcome, everyone. My name is Dante Gennaro, and I'm the Health Communications Coordinator emceeing today's webinar on behalf of the Connecticut Department of Public Health. Today's webinar will consist of a brief update on the state's response to the monkeypox outbreak, followed by an in-depth look into the life of one of Connecticut's first confirmed monkeypox patients. Around 1:30, we will open up the conversation to the rest of the webinar attendees and review some questions you all have submitted in our Q&A box. So let's get started. I borrowed this slide from a presentation from earlier this week on Monday, August 8th. That was given 3 days ago. All 48 cases are persons who identified as men, and among 39 cases with information about sexual orientation, 95 of them identified as LGBTQ. As of right now, or as of August 8th, there were 48 cases. And I can say that in the couple of days that it has been since then, we have jumped up to 54 cases in Connecticut, but unfortunately that demographic information isn't going to be represented on this slide. That information will be provided in the next update. So the median age is 34 years old. Most cases of people with monkeypox are between the ages of 20 and 49. 56% of patients identified their race as white, and 32% of patients identified their ethnicity as Hispanic or Latino. When we break down the cases by county, New Haven takes the lead with 17, followed by Fairfield with 14, and Hartford with 13. Litchfield, Middlesex, Tolland, and New London counties have less than 5 cases. And again, as I had mentioned, today's Thursday, August 11th. Connecticut has had 6 more cases reported. The demographic information will be provided at the next update. We also currently have 20 vaccine testing sites throughout Connecticut. For the updated list of all of those locations, I strongly recommend you all take a look at our DPH Monkeypox webpage. The URL for that is located at the bottom of the slide, but it's ct.gov/DPH/monkeypox. So moving right along, I'd like to introduce today's panelists. I think it's worth mentioning that our society places a lot of stigma and judgment on us as people and as human beings, and that for someone to have the courage to step up and provide this kind of insight is very commendable and a brave thing to do. During the panel discussion, everyone attending is welcome to submit any questions that they may have into the Q&A box, and we'll do our best to address as many questions as possible. I just want to also make mention that as the MC of this webinar, part of my role is to protect the panelists, and so I ask that anyone submitting a question, do your best to be respectful. Any questions not asked in an appropriate manner will be deleted. If there are any remaining questions not answered on this webinar, they'll be recorded in a document with all of the questions and answers will be put on, and that will be put on the Monkeypox webpage along with a copy of it translated into Spanish. So again, any question not answered during this webinar, we will document it, we'll get the answer to it, put it in a document on the DPH website, and have it translated in the Spanish version as well. So without further ado, it's my pleasure to introduce Johnny Rivera. Johnny, thank you so much for being with us today. I can't express enough gratitude the Department of Public Health and I have for your willingness to speak with us today.
No, thank you, Dante. I'm grateful to be here. I'm greatly appreciative for this platform. I think that it's integral to getting the word out about monkeypox. So thank you guys very much.
Thank you. So you were one of the first people in Connecticut who was diagnosed with monkeypox. At what point did you realize that you needed to go to a doctor to be tested?
In short, once I recognized that I had pretty much all of the symptoms for monkeypox, happened rather rapidly, and I had gone home and tested negative for COVID. So I'll backpedal a little bit and just state that on Monday, July 11th, Kind of something that in hindsight I look at, and probably was one of the symptoms was I started getting abdominal abdominal cramps. Oh my God, I can't
Mhm.
speak. And it did start with diarrhea, and I thought maybe that this didn't pertain to anything else. In fact, I got a text message in the afternoon from my partner who stated that he had been quarantined for a possible case of monkeypox. I thought the probability of this was slim to none. There were only, we were Googling it, there were only 3 known cases at that time in the state of Connecticut. Um, I did a self-assessment and I was feeling fine. And after having looked online at some of the various stages of a lesion for monkeypox, I did a self-assessment and I found like what looked like ingrown hair
Mm.
on my right buttocks. And I wasn't too worried about it until I would say the next morning. I think it went from being what they call a macule to a papule. So it went from being a flat lesion to being a raised lesion and slightly hardened.
Mm.
And at that point, I had concern. So I tried to get some clearance from my doctor, reached out to him. Unfortunately, I didn't hear back from him. And since I didn't have clearance and I really wasn't too symptomatic of anything else, I wasn't sure. I went to work and I just tried using common sense, tried taking precautions, washed my hands. I didn't have any lesions on my hands or anything of that nature. I wore a mask and I just kept a distance from people and made note to pay attention to my symptoms. So that's around 7 p.m. that evening. Right away, I'm having an incessant running nose, sneezing. I'm thinking maybe it's my allergies, but it's so incessant. I get a Benadryl at work and to dry myself out. I start noticing that I'm having some cramps, mild cramps in my legs around like 8 p.m. I'm getting achy in my back. I'm getting chills. I notice kind of a itch in my throat.
Mhm.
Mm, And probably around 9 p.m., 10 p.m., I'm starting to develop a mild headache. And these sites that I had never seen before are pronounced enough that they're becoming bothersome. They're tender. And soon enough, I've noticed when I'm walking that my lymph nodes in my groin are beginning to swell.
Oh,
So
wow.
this all happened rather quickly. And for me, that was time to leave work and reach out to a provider and to get tested.
So it's
Like I said, I went home and tested negative for COVID, and then that was it.
so it's fascinating because I believe when originally we got word basically that monkeypox was reemerging and that there was this outbreak going on and that it was this new strand, everybody was really going back on what we had learned in the past from previous exposures with monkeypox. And they said that fevers were the first sign and the chills and the swollen lymph nodes. And then after that was typically when people would have the lesions and the rashes and the blisters. But what I think is so, it's science, it's the virus mutating and changing. And you're confirming with your personal experiences that we're hearing now with this particular strand that in fact it was the blisters that were first, as opposed to the rashes and as opposed to I'm sorry, as opposed to the fever and the swollen lymph nodes. So it's interesting that this time around that we're dealing with this, that we're learning so many new things. How did it make you feel when you when you got that positive test result from your provider?
When I got the positive test result, I actually laughed at my doctor because by the time that I received confirmation from the lab, I was 2 days in with a fever, the aches, and the lesions had begun to take on the various stages of monkeypox. They were pronounced. They were I think it's called umbilicated, which is like they had like
Mhm,
this little divoted center and
mhm.
circumscribed. So they started to look like a pox. They were definitely tender. They're growing rapidly. Um,
Do you
yeah,
mind?
I had
I'm sorry. Do you mind me asking if you could estimate about how many do you feel like you had on your overall body?
this was this was just the two original lesions. And so I already knew I had monkeypox. I kind of took it as it is what it is, kind of like I played, I pay. It was just very matter of fact. I knew I was gonna have to take care of myself. Obviously, gonna go into quarantine, and so I just started thinking about essentials, how I was going to procure essentials, groceries, how I was gonna wash laundry, thinking about my finances, short-term disability, can I get paid leave, all these various aspects. And I thought, kind of going into it, that I was going to do it solo on my own, kind of just like any other problem that you would face in your mundane life as an adult. And I was rather optimistic that this was only going to last for a week or two. And, a week later, it was quite clear that this was going to be a long road and I needed to reach out to people and utilize all the resources I could.
Well, we're very fortunate that you were able to. And I have heard of a number of different accounts from social media. You can see a number of patients and people who've confirmed with that they have monkeypox that they show that they have lesions on their hands, they have the blistering on their faces. And I'm wondering, were you only primarily experiencing those lesions on your backside, or did you not have any other uh, areas that were?
Well, what happened is there were the first two sites,
Mhm.
and then kind of came on the severity of this whole rash of symptoms,
Oh, I
and
see.
they were rather intense, and they occurred over the course of, I want to say, 5 days. I had a fever for 5 days, and it was when I
Oh,
broke
wow.
my, yeah, I had a fever. I ranged typically from 100 to I was 102.5 when at my highest recording, and I suspect I was even higher. That was the only reason that I got a thermometer. I almost fainted in my kitchen one day, and so I was like, I have to get a thermometer. Um, but it wasn't until day 5 or 6, when all of a sudden there were four random sites that were on my arms. And over the course of the next 3 or 4 days, that turned into a mass of 22 various sites in my body.
Oh, wow. Okay.
Yeah.
Um,
Those were
so
everywhere from just everywhere.
all over your body. Wow. Prior to acquiring monkeypox, and I know, like you said, when you Googled it, there were only 3 confirmed cases. What did you believe were your chances of acquiring the virus at that time?
So, like I said, it was kind of like you play, you pay, very matter of fact, because I was cognizant of it. I remember when the first man was diagnosed May 17th, first man from Massachusetts went to Alberta, came back. I remember paying attention to the news and kind of hearing it was on the periphery.
Right.
Uh, I remember going up to Rock River, is a gay men's swim hole in Vermont, Memorial Day weekend, and I heard an older gentleman greeting a younger gentleman, and the younger gentleman reached for his hands and he joked about, like, do you have monkeypox? And that stuck out in my mind as well. So I would say over the month of June, my sexual activity had increased more than I am normally sexually active, or at least my chances of exposure to the virus had
Mhm.
increased. So I was starting to become more mindful. I actually tested around the third week of June. I wasn't symptomatic for anything. So when it happened to me, at first, when my partner informed me, I thought maybe this was syphilis or something of that nature instead. And with there being 3 cases, but it was shocking. It was a bit of a sting to be so naive and to be one of the first cases in the state of Connecticut, to think it could have happened to me. And then here I am.
That's usually the case too. We hear a lot with infectious diseases. Unfortunately, I've worked for years in HIV prevention, and very similarly, there's usually it's affiliated with the younger population. Is that's not going to happen to me. That doesn't happen to people like me. That happens to those types of people or to them. And so when it does happen to us, it can kind of throw us for a loop, and we're like, wait a second, how did this, did this happen? And I just would like to go back to something that you had said about the pay you play statement that you had brought up. And it's basically you acknowledging that as a human being engaging in sexual activity, that there's going to be some risk involved whenever we're engaging in sexual activity. And I just like to point out that that goes across the spectrum. That does not matter whatever gender, ethnicity, race, sex you are. There is always a risk. And to touch on some of the prevention messaging that we've been trying to work on with monkeypox, this virus can go to anybody. There is no, the virus isn't picky. It's not saying I'm not going to be infecting, those people over there. It's just that it's right now within a certain demographic. It's a pool of it's a community. It's a small pool of community people that engage in sexual activity among themselves, and so that's why naturally there would be a higher rise of that virus in that population. Now I can say that there have been a couple of cases confirmed in the United States with children, and with a couple of possible exposures due to children hanging around with people who were infected. And there's a lot we need to do our best to be protecting and to be preventing the spread of this. So we can go on to talking about vaccines at another webinar, but I'm just curious, what would you recommend as an example for prevention messaging? What would you like to see? Because again, like you said, we first heard about this in May. I know myself had created promotional material back in June, especially during Pride Month. I was doing my best to try and create some documents that we could get out there to spread awareness about this situation. But now in August, is there anything that you'd like to see that maybe we haven't seen?
Oh yeah, absolutely. I mean, I recently took it upon myself to I've been using all my social media as a platform relentlessly to talk about monkeypox. I took a selfie even, and I think it said something along the lines of, my partner gave me monkeypox without having lesion, pimple, or rash, because that is my case, and or at least not one that was visible. So the media is, I feel like we've sent people out there looking for pimple and rash without people realizing that, droplets is a mode of transmission. Someone can still be infectious if they're symptomatic, they have fever, ache, chills, all these other symptoms, and transmit the virus to you. So if there are, and especially since this is affecting the gay community right now, gay men going out there thinking that they can just base whether, that they can have safe sex with their partner because they're not presenting for a pimple or rash, that's not accurate. I would like to see it be portrayed. I feel like monkeypox isn't being taken seriously enough, and the severity of the symptoms. I'd actually like to touch back on symptoms again, if we can, Dante, but the severity of the symptoms is really not being portrayed. And for example, one of the symptoms is rectal bleeding and pain with stools, bloody stools. And some of that is so bad that people are being hospitalized, but you're not going to get that on your evening news. And the reality is this is affecting mostly gay men. The information is being, if you're not going to the CDC website, being given to us on the evening news by a large heterosexual community. People don't really want to talk about gay sex necessarily, or anatomy, and that kind of detail. But I think lastly, what I would like to see is, people don't want to stigmatize this, but we have to speak to the gay community because it's in the gay community right now. And this is not to shame anyone or judge anyone. I contracted my case from a Grindr hookup, the same person, a repeat Grindr hookup. And I feel like we need to make it known that people need to refrain from hookup apps, and people need to not engage in promiscuous or anonymous sex because they don't know their partner's sexual history in the last 3 weeks, how many people that they've been, if you're not getting vaccinated. And the reality is only about a third of the population, gay population, is able to meet criteria for vaccination right now. So we have 2/3 of our community still being sexually active and exposing themselves to this virus. Yeah, and no one wants to hear the word abstinence, but I think in the wake of a outbreak, it's not unreasonable, but we can be creative too. There are other ways to have sexual exchanges that do not involve body contact.
And you touched on so many things that was we could easily break that down in a whole other separate webinar. But to your point, 100%, we want to do our best to meet people where they're at and recognize that asking people to abstain completely from sex is a rather difficult thing to do. But to encourage people to just be aware of the level of risk. And if there are ways of really promoting harm reduction and cutting back on those opportunities, or getting vaccinated has been proven to be an effective measure to reduce the symptoms. Doesn't prevent anyone from getting monkeypox. Let's just make sure that that's clear, but it can reduce the symptoms. I think it's important that we do continue promoting the messaging, and we can do better. Like you said, people don't like talking about non-heterosexual sex, and so yeah, we do need to be more creative, and I welcome you to definitely be one of my critics and let me know any constructive criticism on any upcoming monkeypox messaging that I put together. So touching on stigma, what has your experience been around stigma? Have you had any did you have to deal with any external stigma from providers or partners or friends, or did you have to deal with any internalized stigma? Thoughts from yourself?
Well, I'll touch on internalized stigma first because that's probably the fastest one to get out of the way. Because as a gay man who loves himself and gets over adversity and oppression, what is stigma to that person? But to speak to external experiences, I think I was so well received in the beginning of this that I was kind of naive to what was happening on the outside. There was some news interviews, and I was using these social platforms, and I had so much support. And I can hear people in my community talking about how people are going to stigmatize us against the community. So there have been some instances. I had someone on Grindr, because I used my Grindr as a PSA to let people know that I contracted the virus there. Asked me, like, you didn't see lesions on your partner? And I was like, no, my partner didn't present lesions. So it was almost like I didn't have common sense before engaging in sex. That was probably like the only personal account I had. I know online, even for the Hartford Gay and Lesbian Health Collective, had a Genios PSA, and someone commented with something regarding about a suggestion for reading emerging viruses, AIDS and Ebola. So I think the implication there was gay men spreading diseases, monkeypox and AIDS. You see, if you look at any CNN article or anything of that nature, you see the comments in the thread, and people are definitely letting their ignorance out. I saw a friend talking about how right here on Pratt Street in downtown Hartford, he overheard some men talking rather intentionally, loud enough so that this group of gay men walking by could hear them saying, oh, we don't understand gay pride. What do gay men have to be proud of right now when they're spreading monkeypox? So the ignorance is there. But also, one thing that I want to touch on with stigma is that the community, and with good reason, is concerned that the heterosexual community, or specifically Republicans, if we get political, they make reference to AIDS in the 80s and how this can be used to stigmatize the gay community and be weaponized against us to strip us of our rights and what have you. And I think that's one of the reasons it's so important for us to do what we can to stop the spread of this. I don't think personally that we owe any validation to anyone, or that's my personal belief. But if people are concerned with that, I would think that that's a motivating factor to protect the gay community in more way than one.
So I can say that it is definitely a concern that this virus and that this outbreak be specifically labeled a gay virus or a gay disease, because as I had explained right from the very beginning, this is something that can impact anyone. Any human being can contract monkeypox. So I think where I can speak from my own personal experiences in trying to create prevention messaging, I had to be very careful to kind of tiptoe on how do I create prevention messaging that is going to resonate within the community that I want it to hear, and that I want people to gather that information without labeling that community as the problem community, and without saying that it's those people's problems. And so it is very much a dance, and there's a fine line. My personal belief is that we present the facts and you stick to what is the science, what is the data, and then present that information and saturate it within that community that needs to hear it. You don't need to put on that messaging any sort of emphasis that it's about the specific demographics of people who are the highest at risk. Again, focusing on not stigmatizing and not labeling it that particular group of people's disease or issue to deal with. But yes, there's tons of challenges, and I'm sorry to hear that you're continuing to hear experiences from yourself and from your friends of that sort of talk about what's there to be proud of. It's unfortunate that this is 2022 and we're still dealing with this. So, all right. Let me see. I'm sorry, go ahead.
No, for sure. Dante, do you mind if, as quickly as possible, I try to go through some of the symptoms that kind of took up the bulk of the virus?
Absolutely.
Okay,
Please.
so pretty much once I've been diagnosed, it is like 3 to 5. It was immediately excessive sleep, deep sleep. I couldn't get enough. I was extremely exhausted, so exhausted my extremities felt like weights. I couldn't do simple mundane tasks. It took me a week before I was able to get to my dishes. They piled up. I had to use paper plates. I couldn't take care of myself properly. Grooming. The aches were incredibly intense, hot and cold flashes. Like I said, I had a 5-day run with a fever from like 7 p.m. to 7 a.m. With 102.5 being that my highest temp. I was often very winded in this period. I couldn't catch my breath. I had a dry cough that hurt my head to the point where I was Googling encephalitis to see if I had it. But also I would wake up in the morning and be hacking like sputum almost like a productive cough as well for quite a while. My lymph nodes were doing this dance for 3 to 5 days where one would be, they were just become engorged. I've never felt my lymph nodes like this before. And it would literally be within a couple of hours from being completely engorged to just nothing. And sometimes it was so painful that making a large stride felt like I was pulling a muscle.
Wow.
I've had experienced sharp shooting pain, and so did my partner. That, yeah, we compared notes. We keep in touch every day. For a day or two, it was like a nerve pain that shot up my leg. We experienced incredibly dry mouth. I'm sure due to dehydration, I could not drink enough water. I had to drink Pedialyte. Water just wasn't sufficing. I would have like 4 pint glasses in 2 hours. I had about 3 bowel movements over the course of like a week and a half, very small. And so I was definitely constipated. There was a time where I was bleeding for 3 days rectally. And I thought it was because of using so much Motrin and Tylenol. Um, I know for a fact my lower rectum was inflamed, and the pain for peristalsis is kind of like the contraction that happens when your stomach is, it's what
Moving
your
the
body
bowel.
uses to either have a bowel or to digest food. It's just that whole movement. So it
Hmm.
was like I thought I was gonna have a movement and I wasn't, and the pain would just be so intense. So, and I've actually heard that this is, I mean, these symptoms, the bloody rectum and what have you, the pain, other people are experiencing this, people are being hospitalized or this. And so I just wanted to emphasize all these were kind of, and this was then day 6, kind of these pustules that were really itchy and bothersome. They were almost like my last concern, really. It was almost like these were a reprieve compared to that intense 6 days of the initial
Wow.
part of the virus.
That definitely sounds intense. Um, my gosh. Thank you so much for
Yeah, I want
sharing
people to know what it's really like.
in such detail. Yeah. Um, and I can tell you that, right now in the state of Connecticut, people who are confirmed to have monkeypox, the treatment is to get them on T-Pox, which is to help try and mitigate that pain that they're going through while their body is healing and trying to deal with these symptoms. So I know that we're making some progress. Um, all right, well, that was all that we had for planned with us. I'd like to open up for the rest of the attendees. We have about 25 minutes left. If anyone has any questions that they'd like to ask Johnny, please feel free to throw those questions into our Q&A box and we will get through as many as we can. And again, anything that isn't answered today, we're going to be documenting those and then providing a document afterwards on our DPH webpage with all of the questions and answers. So have you ever had chickenpox, Johnny?
I have.
Somebody asked, is this similar to chickenpox? So I guess how would you compare this to what you can recall from having chickenpox in the past?
Well, I was so young when I had chicken pox, in all fairness. So, but I do remember because my siblings and I all had it at the same time. I just remember it being incredibly itchy. Um, there was a moment where this was like that, but I would say this is far worse for sure.
Mm, it definitely sounds a lot worse. I don't recall. I had chickenpox when I was a kid, and I don't believe I had any of those symptoms that you were identifying. Um, were you tested in Connecticut or out of state?
I was tested in Connecticut, and testing is actually very painful. If I could just touch on that too, because within, like I said, Monday was my first site. It went from being an ingrown hair to Wednesday morning. I'm now in my provider's office. The site has become raised. It's filled with fluid. It hadn't been popped. They take their swabs to obtain a culture to get some fluid, and that involves pressing into the lesion, which was very painful.
What, and I have heard that they are trying to do that in multiple sites. They actually are asking for around, I believe it's 3 sites, because in case the provider doesn't get an adequate sample with one, they'd like to have additional samples to confirm rather than give a false negative results. So I could imagine it would be painful having 3 swabs aggressively pressed into an open sore or
Yeah.
blister. What was the contact tracing process like for you? Did DPH ask you to help notify people who might have been exposed?
DPH did not. DPH did ask me actually, but I was already on the ball. Lucky for me, like I said, I had just gotten tested, and June was kind of a more active month, and I was cognizant of this, and I just knew intuitively to slow things down. So I had 2 partners, one of which I had intercourse with twice, and the other was just kind of a cuddling session, makeout session. So I had to reach out to that individual. Luckily, I was able to reach. I was in contact with all my contacts. So, but DPH was really good about getting on top of that and making sure that they knew who was who and how they could reach him.
Awesome. That's good news. And somebody put in, first of all, thank you for being so willing to share your personal journey with us. It's been very enlightening. Do you think that information about monkeypox would be well received at known gay bars or other such locations that you identified, such as the swimming location that you mentioned?
I love this question.
Oh, you're muted. I'm sorry, Johnny. Johnny, hang on a second. Can we think? There you go.
All right, I just got muted there for a second.
It's okay. I get excited and I mute myself too sometimes when I do these meetings. Go ahead.
All right, there you are. All right. I think it would be well received. I don't understand why anyone wouldn't want to educate themselves and be concerned about their health. I mean, even if you're having a drink, I mean, if we can have trivia, this or that or the other, I don't see why this can't be done in a social setting. But more importantly, I would like to see our local gay bars stepping up and taking a part in getting this message out.
Mhm. All right, another question was, were you able to access treatment with TPOX?
I was not able to access treatment with TPOX. And I mean, if you want to find me on social media or even my Instagram and message me, Rivera _ Johnny C, I can tell you about my story with vaccination and how I tried to obtain it. But or even TPOX wasn't even offered to me.
At the time?
But TPOX was about mid virus. TPOX was something that was put on the table, not in my for my particular case. I know it's hard to obtain. I heard it was becoming easier, but remember, I'm one of the first cases in the state of Connecticut. I think there was like 1,400 cases nationwide when I contracted the virus, and now I saw a notification before this that said we've reached 10,000. So I missed that window.
A number of people are asking, first of all, you're getting a ton of support. Lots of people are saying thank you so much for speaking up about this.
Thank you all.
Because again, it's so important. We're not just numbers, we're people. And looking, like you said, at that 10,000, cases, those cases are individuals whose lives have been turned upside down by this situation, and we need to be mindful of that. So people are wondering, did you have any lingering symptoms? How are you feeling now?
I'm feeling great now. I just want to make it known that from the time of the first lesion, which was probably on the 11th, until the last, like I'm just healing from this, and this is about like like 26 or 27 days later. So I just
Yeah, it's a
got,
month.
yeah, it's a month. It's a
It's
month.
a
I feel great. The last week and a half, 2 weeks was, like I said, more bearable. The sites they were itchy. Um, you get nervous. I think you develop like this neurosis because you're like, oh my God, am I going to further contaminate myself? You're putting linen down, or I recommend you put linen down on top of like anything that's upholstered, or you're worried about taking a towel and it coming into contact with something. You're worried about reinfecting yourself, and you really don't know if you're doing it to yourself or if it's the virus running its course. But I do feel better now, and um, I think that first week and a half was probably one of the more intense experiences I've ever had in my life.
got it. Okay. Let me see here. We got another question. Um, about how much time would you say had passed between the contact with your partner, with your infected partner, and the start of your symptoms?
So my last contact with my partner was on the 7th, and he became symptomatic over the weekend, but didn't reach out to let me know until the 11th. So it was literally like 4 days.
And
Um,
did and were you presenting symptoms on the 11th yet?
well, technically I found that whitehead, so I would
Okay.
consider that to be the beginning of
Yes.
being symptomatic.
Yep.
I mean, for all I know, because I did, my partner and I did have intercourse on the 1st to the 30th. So, I mean, the incubation period is up to 21 days. So it could have been from them, but I really don't think so. My partner was complaining of being, ironically enough, lethargic on the 7th. So I think he was symptomatic on the 7th. And I think literally within 4 days, I became symptomatic.
Okay. So a 4-day window period. Um, Somebody asked a question that you mentioned that you had just become more sexually active, socially active as June hit. Do you think that part of the timing of this wave that we're seeing is related to summer moods, Pride Month, and COVID sort of stir craziness? Because it feels like your story is very in keeping with that kind of thing. And also,
Absolutely.
they said thank you for speaking about this.
Oh, hey, you're welcome. Thank you. Thank you all. Thank you for the support. Absolutely. I mean, I get riled up when it's like spring, summer, the sun is coming out, and we're like after like the 6 months of brutal New England winter. Um, I get spring fever. So I imagine it happens to everyone else out there. I think the season is definitely a part of it. Pride, of course, pride. People are being sexually active in pride. People are dancing and they're shirtless at pride. So yeah, pride events. Yeah, of course. Those are all contributing factors.
I can tell you, I had a personal conversation with the commissioner of the Connecticut Department of Public Health when this was first kind of coming out, and uh, back at the end of May, and I had expressed as a self-identifying gay man myself. I can completely relate to this in that we just went through 2 years of COVID lockdown and not being able to socialize, not being able to go out like we normally would in the summer on vacations and trips. And then finally, people are getting vaccinated. We're not hearing about COVID as much. Everyone's wearing their masks. So this is kind of like, we got this. And now all of a sudden, here's this surge of this new virus that we're all needing to worry about. And I had told her, this is taking a toll on the mental health of gay men and the LGBTQ community, because it's like there isn't a break. It feels like there isn't a break. And so I just I wanted to point this out and talk about it because this is all a part about being human. And I don't, this isn't about a specific population of people. I feel like anyone who would have gone through uh, what the LGBTQ community and has gone through with this over the last month and the last couple of years can relate. But it's unfortunate. I hope that more people are being aware and taking precautions. Like you said, Johnny, your partner didn't happen to have any blisters present or visible. And, as you mentioned, with symptoms that you had and other people have reported having those internal blisters inside of them, inside of their rectum, and
Yep.
around the genital area, that isn't something that you would necessarily be able to see just by looking at someone from outside.
Yeah,
So,
correct.
and so, we need to have conversations about what ways of increasing protection and bringing awareness so that people can make decisions, well-informed decisions, and not feel like they're caught off guard.
Absolutely.
Great, thank you for submitting that question. Um, again, lots of support. Somebody would like to know what. Well, and I know you had talked about this a little bit. Prevention. What does prevention truly look like in your opinion? I know you had touched on this earlier about abstinence. I think
Yeah.
I can tell you that in this registration that I've seen for today's webinar, there's a lot of health departments. There's a lot of people who are doing work in the field trying to get the word out there. And we don't want to preach something that isn't going to be well received or that people are going to look at and think you're totally not, in
Not a
with
touch
who
of
you're
reality.
talking
It's not
to.
gonna happen.
Exactly,
Yeah.
exactly. So from like a meeting people where they're at, what would you say?
Okay, so obviously regular testing is something that everyone should be doing gay or straight every 3 to 6 months, especially if you're sexually active. And I think that's kind of basic knowledge if you have a basic knowledge of
Your sexual
STIs
health?
of your sexual health. I think you need to be
Yeah.
aware of your sexual health. Think you need to be sex positive. I think you need to have conversations with your partners. I would say right now, limit your partners and try to be safe. Get vaccinated, but definitely having conversations, being cognizant of how many sexual partners you're having, what risky behaviors are you engaging in, and just trying to limit those right now and put yourself in a space where you're as healthy as you can be and
Mhm.
where you're contributing to the health of others as well. That's it.
Thank you. And I totally agree. People should always be as aware as possible, which you know can be somewhat of a challenge. A couple of questions, and you touched on this actually just now. A lot of people are saying outside of abstinence, what recommendations? So, and getting
Yeah.
vaccinated. Um, Let me see, what's another question here? As public health workers who will be doing monkeypox contact tracing or symptom surveillance, what would you say is the outlook of the LGBTQ community when it comes to contact tracing? What kind of response can these workers expect, whether it be openness, hesitancy, um, and then they said thank you for all of your awesome work that you're doing.
You're welcome. I think this is a great question because people are really, there is stigma and people feel shame sometimes. It's hard. I'm an open person. Um, you feel it, I have to go against it. Like you're like, um, I think there's that shame. I think sometimes they feel like they're that like someone's out to get them. They're in trouble kind of a thing. They don't realize that this is people trying to contact trace, make sure we're stopping the spread of something. But also I saw and or I heard of in one of your previous webinars, there was a website maybe that allows people to anonymously reach out to a contact. I'm not sure about that, Dante. I wish I had the link and that I could provide it. I actually do somewhere in an email. So maybe in the answer portion that gets answered later on, it could be provided. But
I don't
you
believe
know,
that pertained to monkeypox. I do know, I think I know what you're referring to with online ability for people to reach out to partners anonymously and they can be
Okay.
notified from the partner. But I think this is more about like what kind of a heads up can we give these the healthcare professionals who are going to be going out from local health departments, going out and conducting the contact tracing. Is there a way that you would almost like recommend people have an approach to it? Because I think you were touching on it when you said that people can
Yeah,
feel
I
like
think
a
you have to
little
be
bit
soft.
nervous.
I think you have to, yeah, you have to be open and you have to make people feel safe. You have to
Mhm,
make people feel safe.
absolutely. Anybody, I feel like that goes across any group of population of people. They need to feel safe if you want them to open up. Great suggestion. Um,
I love it. Keep them coming.
I know it. We had another person saying lots of thank yous. That's why I'm scrolling through. Lots of thank yous, lots of praise and appreciation.
All right.
Um,
Count them all later, Dante.
so here's an interesting way, and I am curious what you have to say because I have an opinion on this as well. But would you give some thoughts or advice on how to ask detailed sexual questions in the most supportive, positive, and professional way?
I think if you're asking questions that pertain to someone's sexual activity, if you're being medical, and you're using medical terminology, I think that's enough. I would say other than that, maybe tone inflection and body language so that people receive
Absolutely.
you well. But I think really, I have a medical background myself, and I think if you're using the medical terminology, if you're using the science, you know, and
And I mean,
maybe be keen to cues too, if you see that someone's uncomfortable, you can address inform someone or something, or again, make them feel safe.
yes, and it is a little bit of a challenge if you're doing these types of interviews over the phone because again, you're not able to physically see the person. But
Yeah.
to touch on what you said, I agree with you 100%. I think that tone and I say there's an expression that I say during meetings that I conduct around "don't yuck my yum," and "don't yuck my yum" is a reminder to people that just because there's something that I might be interested in and you are not interested in that, or it's something that doesn't pertain to you, uh, be respectful. Don't don't yuck that person's yum. And so I think kind of in tone with what you're saying, if you are approaching somebody with this understanding that they're a human being and they're doing something that was consensual and that that they wanted to do, coming off in with a sort of tone that you are patronizing or talking down or looking down at them, how could you not? um Let me see, do we have time? There was a quick example where I had heard back when I was doing outreach in the field with HIV prevention. People are at a bar and there's a man and a woman and they leave together and decide to engage in sex and didn't use a condom because the woman was on birth control. What would people's response to that be, as opposed to two men who are at the bar and decide to go home and because they can't conceive a child, decide not to use condoms? What would that response be? And there's a lot more judgment against the men having sex without a condom because why wouldn't that person uh, want to protect themselves? Why wouldn't that person? And I think people kind of forget that it's not the same. People don't view the same sort of judgments with heterosexual sex as they do with the LGBTQ community and how gay men have sex and the
Yeah,
risks
well, you
involved.
definitely, I think if you, I would assume being someone from the DPH and you're making a call in to someone and you're trying to obtain this information and you're trying to be, you're trying to get your patient to be receptive, cognizant of the fact that they already feel some discomfort, or there's some distance in that they are no, well, for some people might be a little more, a little too open or more open like me, but you know, you might have something going against you right there, you know, right up front, is that they're, you know, they they're probably already thinking in their head, oh, this person's, you know, a heterosexual person, I have to talk to them about gay sex, you know, they probably have a judgment. So just maybe be mindful of that.
Great advice and great question, because it's definitely a challenge. All right, so I want to be mindful of the time, and let everybody know that thank you so much for submitting your questions and for attending today. Any questions that were not answered will be documented, and we're going to be, like I said, putting that document up onto our DPH website on our Monkeypox webpage. But again, thank you so much for joining today's webinar on monkeypox and stigma. We've had a great discussion with Johnny, and I hope that your questions were answered. The answers that are going to be located online are going to be in English and Spanish. So hopefully that will help with our prevention messaging. And again, this webinar is one of a series that the Connecticut Department of Public Health is putting together about monkeypox. Today's webinar will be uploaded onto our DPH YouTube channel, and a link will be located on the Monkeypox webpage tomorrow. Thank you so much for Johnny for joining us today, and thank you so much for everybody for attending, and we look forward to seeing you guys next time.
Thank you, Dante, and thank everyone as well.
Thank you. Have a great day, everyone.